Let's discuss differential diagnosis, Western and Chinese medicine, rhinitis. An inflammation of the nasal mucosa. Signs and symptoms: excessive mucus production, congestion, sneezing, paroxysm, watery eyes, nasal and ocular pruritus. Number one, allergic rhinitis. Associated symptoms are fatigue, malaise, headache. Symptoms usually develop before age 20. Family history, allergic shiners, blue, gray, or purple discoloration under the lower eyelids, mouth breathing, conjunctivitis. Letter A, comorbidity with asthma, eczema, chronic sinusitis. Letter B, differential diagnosis, occupational rhinitis, exposure to irritants and allergens including laboratory animals, grains, coffee beans, wood dust, tobacco smoke, cold air, formaldehyde, hairspray. Second, perennial rhinitis. Allergens may include molds, spores, dust mites, animal dander. Third, seasonal rhinitis. Allergens may include plant, grass pollens, and mold spores. Number two, non-allergic rhinitis. Associated symptoms are post-nasal discharge, enlarged tonsils, perennial symptoms, symptoms aggravated by irritant exposure and weather changes, and usually there's no family history. Letter A, infectious rhinitis, acute viral or chronic rhinosinusitis, accompanied by lymphadenopathy, normally self-limiting. Letter B, hormone-induced rhinitis, hypothyroidism, menstrual cycle, oral contraceptives, pregnancy. Letter C, occupational rhinitis. Letter D, vasomotor rhinitis, temperature changes, humidity, alcohol ingestion, odors. Letter E, gustatory rhinitis, particularly hot and spicy food. F, atrophic rhinitis. Letter G, drug-induced rhinitis, antihypertensive medications, aspirin, NSAID, oral contraceptives, rhinitis medicamentosa. H, other types include rhinitis form, emotions, exercise, posture, primary ciliary dyskinesia, reflux or gastroesophageal reflux disease. Chinese differentiation rhinitis, diagnostic questioning according to number one, organ interrelationship in chronic condition, lungs, kidney, spleen, three fluid organ involved. Letter A, weak mental, fails to engender water via Sheng cycle. Letter B, weak earth, fails to dam water via Ke cycle. Letter C, weak kidney, fails to grasp lung qi. Letter D, lung, spleen, lung connected via Sheng cycle, Tai yin, greater yin. Letter E, deficiency of lung and kidney leads to weakness of defensive qi rooted in kidney yang and distributed over body by lung qi. Number two, nature of wind in acute attack. Letter A, wind cold, sneezing, profuse runny nose with white watery discharge, no thirst. Letter B, wind heat, itchy throat, red itchy eyes, slight thirst. Number three, symptoms, seasonal wind with fatigue and lethargy, tendency to catch cold, qi deficiency, poor appetite and loose stools, spleen qi deficiency, symptoms worse at night, dyspnea on exertion, which is kidney deficiency, severe recalcitrant symptoms, which is blood stasis. Number four, emotions, unexpressed grief, fear, excessive thinking and worry, repressed anger, frustration, insulting cycle, wood insults metal. Number five, Sang-Fu patterns, excess wind heat invading the lung, wind cold invading the lung, liver fire insulting the lung, blood stasis. For deficiency, kidney yin or yang deficiency, lung qi deficiency with retained wind, spleen chi deficiency with phlegm. Thank you for your attention.